Good afternoon. The informal meeting of the Commission on Population and Development is called to order. This meeting is held using remote simultaneous interpretation. I ask the participants to be mindful of the additional difficulties experienced by interpreters when working remotely, and of the increased likelihood of disruptions to the audio feed to the interpreters. I also remind participants inscribed to speak to send a text of their statement to e-statements@un.org in advance of delivery. Participants may select the preferred language to hear the interpretation or choose the none option to hear the original language of the speaker. Speakers will not be able to unmute their microphones or engage their video until given the floor. Excellencies, I now invite the Commission to resume its general discussion under Agenda Item 3, entitled General Debate, and its sub-items A and B. Before giving the floor to the first speaker, I would like to remind delegations to kindly respect the agreed time limits of 4 minutes for member states speaking in their national capacity and 3 minutes for intergovernmental organizations and UN system entities and for non-governmental organizations in consultative status with the Economic and Social Council. I now give the floor to the distinguished representative of Côte d'Ivoire, to be followed by the distinguished representative of the United Kingdom of Great Britain and Northern Ireland.
Muchas gracias.
Thank you.
Monsieur le Président.
Chair, ladies and gentlemen, the delegation that I have the honour to lead on behalf of Côte d'Ivoire and on behalf of Madame Niela Kabe, Minister of Planning and Development, welcomes the holding of this 54th session of the Commission on Population Development and aligns itself with the statement made by the Group of 77 in China, as well as that made by the African Group. Chair, ladies and gentlemen, in Côte d'Ivoire, we are clearly aware of the socio-economic issues linked to demographic developments, and this means our national ambition puts demographic trends, human capital and social welfare back at the heart of our strategic planning to improve our Human Development Index and to boost the improvement of social indicators and more specifically the SDGs. Chair, ladies and gentlemen, the Ivorian government has drawn up and implemented several institutional reforms as well as policies and programmes across sectors which are rooted in these different development plans. These include our national policy for nutrition and our multi-sectoral nutritional plan, an agriculture investment plan at the national level, and a strategic plan for development for fishing and herding. Ladies and gentlemen, Chair, in terms of undernourishment and hunger, we must note that this has slightly fallen from 17.6% to 15.4% between 2000 and 2015, and we expect it to fall to 12% by 2030. Chair, ladies and gentlemen, as we look forward to receiving more specific data, the coronavirus pandemic that around the world has been suffering since 2020 means that our indicators could fall even further in terms of food insecurity and nutrition in Côte d'Ivoire. Chair, ladies and gentlemen, given the aforementioned, it is clear overall that Côte d'Ivoire has made progress in terms of its sustainable food systems. The Ivorian government plans on working resolutely to continue the implementation of structural and sectoral reforms that are far-reaching. The aim is to ensure the well-being of our people. Here, underpinned by the implementation of our national population policy, the government wishes to solemnly reaffirm its commitment to the CPD programme of action and demonstrate its determination to work to implement it fully and swiftly through the upcoming adoption of our budgeted plans of action underpinned by the Nairobi commitments. The government also plans on increasing investments and efforts to strengthen our sustainable food systems, underpinned by improving access to food, healthy and nutritious food, and a transition towards sustainable consumption methods, promoting nature-respectful production, as well as means of subsistence that are fair. Government plans on asking the United Nations system, international organisations and regional organisations and international institutions, financial institutions, to intensify their support and contributions to collect, analyse and disseminate national data to ensure a full, effective and accelerated implementation of the CPD Programme of Action and of the 2030 Agenda for Sustainable Development. Thank you very much for your kind attention.
Doy la gracia.
I thank the distinguished representative of Côte d'Ivoire. I now give the floor to the distinguished representative of the United Kingdom, to be followed by the distinguished representative of Ghana.
Thank you, Madam Chair, Excellencies. Today, at the 54th session of the Commission on Population and Development, we have come together to discuss the critical theme of population, food security, nutrition, and sustainable development. As the brunt of the COVID-19 pandemic continues to ricochet around the world, we must ensure that women, adolescent girls, children, and marginalized populations are prioritized in the response and recovery. Today, I plan to set out the risks they face of food security and undernutrition, the critical importance of the full realization of sexual and reproductive health and rights, and how we plan to carry forward momentum on this agenda over the coming year. According to the Secretary General's report of the impact of COVID-19 on the implementation of the ICPD, there were nearly 690 million people undernourished prior to the pandemic. The UN estimates that COVID-19 will add up to 132 million more to that alarming figure. We know that conflict, economic crises, and climate change are driving food insecurity and have been further exacerbated by COVID-19. The international community must take action to address the root causes of food insecurity and ensure the nutritional needs of women, adolescents, and girls in COVID-19 response and recovery plans. We must ensure that women and girls have a critical role as leaders and decision makers when developing and implementing these response and recovery plans. As the main intergovernmental forum following up on ICPD, we must also examine the impact that COVID-19 has had on the fulfillment of sexual and reproductive health and rights. In recent estimates released by UNFPA, they highlight that disrupted contraceptive use has resulted in nearly 1.4 million unintended pregnancies in 2020. We urge member states to build upon their commitments made in the Universal Health Coverage Political Declaration and prioritize maintaining all essential health services, including sexual and reproductive health services. Safe abortion services are a particular risk during the pandemic. Even where abortion is legal and included in the essential package of health services, many women are struggling to access those services. Member states should consider prioritizing strengthening health systems and explore the use of innovative delivery models like telemedicine to improve access to and achieve the full realization of sexual and reproductive health and rights. There are several key milestones over the next year where we have the opportunity to deliver upon these priorities. First, the UN Food System Summit hosted by Italy. We welcome the much-needed focus it brings to the development of sustainable food systems and the reversal of the current negative progress towards achieving SDG 2 on zero hunger. In particular, we welcome commitments made to build resilience to vulnerabilities, shocks, and stresses, and boost low-carbon and climate-beneficial production at scale. We hope that the summit will result in concrete and actionable commitments made by a diverse group of stakeholders. Following the summit, COP26 is the next opportunity to convene to make substantial, tangible progress towards ending food insecurity. We cannot tackle climate change effectively without placing inclusion and gender equality at the front and center of our climate action. We will champion inclusivity throughout our COP presidency, and we will use our position to amplify the voices and solutions of women, adolescents, and girls, and those most marginalized, empowering them as decision makers, advocates, and leaders. We will seek to address and champion their needs and their priorities in the run-up to and at COP26 itself. Thank you, Madam Chair and Excellencies, for your time and for the important discussions that have been held this week. Thank you.
Muchísimas
Thank you very much to the distinguished representative of the United Kingdom. I now give the floor to the distinguished representative of Ghana, to be followed by the distinguished representative of the Islamic Republic of Iran.
Madam Chair, I wish to align my statement with that of the African group and to make the following remarks on behalf of Ghana. I would like to congratulate you on your appointment as the chair of the 54th section of the Commission on Population and Development, and to wish you and your bureau the very best during your tenure. I would also like to thank the Secretary General for the preparation of the comprehensive report and documentation for this session. Almost 1 in 7 people around the world are chronically hungry, lacking enough food to be healthy and lead active lives. This is despite the fact that enough food exists for all the world's people. Agricultural policies, the prices of certain food commodities, such as meat and grain, and economic development hugely impact food security. But demographic trends also play a role. Increasing numbers of people often drive up demand for food, which typically results in additional use of arable land and water. Food security and lifelong nutrition underpin human capital accumulation and are essential for overall well-being and also at the core of achieving Agenda 2030 and the Africa we want. However, teen pregnancies, unintended pregnancies, unmet need for family planning, child marriage, rapid population growth rate, climate change, together with unsustainable farming practices and COVID-19, threaten to negatively affect the lifelong nutrition and food security of many, especially in low and middle income countries. Madam Chair, this year's theme for this section, the ICPD, Population, Food Security, Nutrition and Sustainable Development, is the most appropriate, as the emergence of COVID-19 pandemic has had implications on food security and nutritional status of individuals, especially women and children. The global pandemic has not spared the agricultural sector, which happens to be the backbone of Ghana's economy, with over 3 million persons 15 years and older of the population engaged in agriculture. The pandemic has tested and challenged 3 significant areas of Ghana's agriculture, namely our production systems, supply chains, and food commodity preferences. As a result, some segments of the population are experiencing health issues and in some cases, mortalities. In Ghana, the proportion of stunted children has decreased steadily, but is still a concern. The proportion of wasted children have also decreased, but very marginally. Improving nutrition is therefore critical for Ghana as a country, which has a structure dominated by children, adolescents, young people, and the youth. In furtherance of this, Ghana has identified and implemented critical policy and investment changes that are transforming our current food systems to ensure that everybody can afford healthy diets that include sustainability considerations. The Ghana Zero Hunger Strategic Review was set out to identify the causes of hunger, food insecurity, and malnutrition in Ghana, and also measures to address the problems. A multi-sectoral and multi-level approach was adopted to maximize the impact. Currently, the Sustainable Development Goal targets, especially 2, have been mainstreamed in all sectors and at all levels. Ghana is adapting to climate change and thereby on the road to achieving food security by pursuing strategies such as expansion of irrigated agricultural areas, improvement of crop water productivity in rain-fed agriculture, crop improvement and specializations, and improvement in indigenous technology. Food security conditions are showing signs of significant improvements as the widespread of harvest of staple grains have aided the recovery of households from constrained access to food, which characterized the greater part of the lean season, mostly between June and November. Preliminary assessment of production of major staples such as maize, rice, sorghum, and millet during 2020-2021 cropping season showed a general increase compared to 2019 and the 5-year averages. However, in a situation of diminishing resources, Ghana is investing in and supporting the development of more efficient, sustainable, resilient food production systems and improving access to adequate food and nutrition by the most vulnerable and at-risk populations and communities. In order to meet the growing demand for food security and nutrition under increasingly high population growth and the difficult climatic conditions, the government of Ghana is making a conscious effort to enhance social protection systems and safety nets as part of the national adaptation agenda. Ghana is integrating population dynamics and climate change adaptation and mitigation measures into its overall development agenda. In addressing the burden of malnutrition, Ghana has committed to ending poverty as per the Sustainable Development Goal 1. The country's commitment to SDG seeks to improve nutrition and promote sustainable agriculture among the people of Ghana without leaving anyone behind by 2030. Ghana is thus implementing a number of interventions to improve nutrition among infants and school-going children. Furthermore, the government of Ghana is investing in the agricultural sector with appropriate policies to ensure a healthy population for national development. A recent intervention in place is the Planting for Food and Jobs. It is a 5-year-long policy which is directed towards increasing food production and ensuring food security for the country, as well as reducing food imports bills to the barest minimum. Additionally, the government has also launched the Rearing for Food and Jobs campaign, another module under a flagship program from 2019 to 2023. This module seeks to develop a competitive and more efficient livestock industry that aims to increase domestic production, reduce importation of livestock products, contribute to employment creation, and improve livelihoods of livestock value chain actors. Ghana is definitely on course to effectively implementing its policies and strategies relating to population, food security, and nutrition towards the attainment of the Sustainable Development Goals by the year 2020. Thank you, Madam Chair.
Doy las gracias.
I thank the distinguished representative of Ghana, and I now give the floor to the distinguished representative of the Islamic Republic of Iran, to be followed by the distinguished representative of Libya.
Madam Chair, the COVID-19 pandemic has had a profound and devastating impact on food security, nutrition, and the healthcare systems of our societies. The lack of access to much needed nutritious food will have severe lifelong health and developmental consequences for women, children, as well as the most vulnerable and low-income families. Without urgent action by the international community, hundreds of millions more people will face staggering levels of poverty and hunger. However, this challenging time has also taught us the significance of our combined efforts and the importance of placing people, especially people in vulnerable conditions, at the very center of our responses. Under the current difficult circumstances arising from COVID-19, unilateral coercive measures seriously jeopardize the food security and nutrition of the ordinary civil population living in the targeted countries, as well as hamper easy access to basic medical items and requirements, thus endangering the lives and health of their citizens. Medicines, medical supplies, and health commodities have been targeted through tight restrictions of foreign exchange resources, violating the right to health and the right to life of affected countries' populations. As the representative of a country whose people are subjected to the most brutal and illegitimate unilateral coercive measures, I would like to seize this opportunity to call for the complete and immediate lifting of all these measures in order to ensure the full achievement of economic and social development, as well as enable targeted countries to effectively protect their populations in the face of COVID-19 and prepare their economies while guaranteeing the well-being of their people in the aftermath of the pandemic. Despite all of the restrictions and measures caused by the illegal sanctions, the Islamic Republic of Iran has taken concrete steps to reform existing policies, improve the overall sustainability of food systems, and ensure food security as well as nutrition for vulnerable populations all around the country. At the same time, the health sector in Iran has undergone significant reforms concerning system policies and services to, among others, achieve the target of universal health coverage and improve citizens' satisfaction with the health service provision and enhance equity. In this connection, women in particular have been provided with access to all necessary health services, including reproductive health care services, along with economic incentives to support female-headed households. As a country hosting more than 3 million refugees, Iran has maintained dedicated to its humanitarian commitments and, among other services, have continued to provide the children of undocumented refugees in Iran with the opportunity to receive education in Iranian schools. As Iranian society faces the prospect of a significant portion of its population aging in coming decades, in light of previous decades' strong demographic transitions, the Iranian government has established a national council for older persons in order to provide a special attention to the elderly population with the aim to implement related policies and programs. Further, the need for a reliable fertility rate above replacement level has been emphasized by the government. I thank you, Madam Chair.
I thank the distinguished representative of the Islamic Republic of Iran. I now give the floor to the distinguished representative of Libya, to be followed by the distinguished representative of Sri Lanka.
بسم الله الرحمن الرحيم. السيد الرئيس، أود بداية أن أهنئ.
Madam Chairman, I congratulate you and the other members of the Bureau on your election to lead the 54th session of the Commission on Population and Development. We are certain that you will enable us to achieve our goals. I would also like to thank the Secretary General for his report for this session. We also endorse the statement made by the representative of Congo on behalf of the African Group. Allow me to make the following comments in my national capacity. Madam Chairman, the theme of this session, population, food security, nutrition, and sustainable development, remind us of the challenges undermining the 2030 Agenda and the SDGs. Developing and developed countries are facing different challenges, and the situation has worsened because of the global COVID-19 pandemic. It has impacted global security and food security. There are higher rates of malnutrition, in particular in developing countries living in situations of conflict and instability. Madam Chairman, ladies and gentlemen, in order to overcome current challenges, we must unite our efforts at the international level. We must focus on the quality of healthcare services, and we must also invest in human capital, improve means of survival, and support for households. In order to do this, we must support the program of action of the 1994 conference. This is a milestone document in this area. Thanks to the SDGs and the improvement in the quality of life, we are seeing a balance between available resources and economic growth. Secondly, inspired by the conclusions of the 1994 Cairo conference and the outcome documents for the upcoming conference on population and development, we must further underscore this balance. We must ensure some arguments do not prevail over others. The discussions must ensure respect for sovereignty, national legislations and decisions, as well as their cultural specificities and beliefs. Fourthly, we must invite development partners and IFIs to mobilize the necessary funds to assist developing countries through the program of action, support from civil society and the private sector. Despite the very complex circumstances we are experiencing in Libya, we are determined to include the issue of population and sustainable development in our national strategies. And we hope that our efforts will be supported by the United Nations and friendly countries so that we can perfect our national statistical system, including the collection of demographic data. Thank you very much for your kind attention. I thank the distinguished representative of Libya. I now give the floor to the distinguished representative of Sri Lanka, who will then be followed by the distinguished representative of Suriname.
Thank you, Madam Chair. Allow me to congratulate you and the members of the Bureau on the election to this important commission and assure my delegation's fullest support for the deliberations of this session. Sri Lanka welcomes the theme of this year, population, food security, nutrition and sustainable development, which in fact is timely. Madam Chair, our people are at the center of concern for sustainable development, and the national policy framework of the government of Sri Lanka, Vistas for Prosperity and Splendor, prioritizes various aspects of the development of our population, which is currently at 21.8 million and growing. According to the Human Development Index of 2020, Sri Lanka ranked at the 72nd, being the highest in the region of South Asia. The Ministry of Health of Sri Lanka provides a wide range of preventive, curative, and rehabilitative healthcare programs for its people. We have an extensive network of healthcare institutions with modern hospital facilities, which are easily accessible with an efficient ambulance service. Sri Lanka is among the few countries in the world that provides universal healthcare facilities to its people free of charge. Consequently, Sri Lanka has one of the highest life expectancy rates in the region of average 77 years. Sri Lanka has also made great strides in improving maternal and child health and welfare. Well over 90% of births are attended by skilled persons within healthcare institutions. As a result, the maternal mortality ratio is 35 per 100,000 live births, and the infant mortality rate is 9.5 per 1,000 live births. The government of Sri Lanka has also introduced nutritional supplements for pregnant women and also for young children. The Triposha program has become one of the main social welfare services, generating great success in this regard, and also is considered as a preventive measure to help mitigate any negative nutrition impact from the pandemic. Madam Chair, we consider that inclusive development rests on equal opportunities at the workplace. 35% of our labor force is female, and we have enacted necessary legal and structural mechanisms to ensure gender parity in our workforce. We are further committed to enabling the youth to contribute to the enrichment of society and also in the country's economic and political decision-making process, providing extensive opportunities. Sri Lanka has also focused on improving the sexual and reproductive health services and to enable young persons to gain greater access to information on sexual and reproductive health, particularly on gender, sexuality, contraception, and sexually transmitted diseases such as HIV. Family planning was first introduced in Sri Lanka in 1953, and a decade later, it was well integrated in the maternal and health services. Today, fertility rates remain at 2.2%, and the contraceptive prevalence rate is at 67.3%. With changes in demography and lifestyles, Sri Lanka is also facing health challenges. NCDs such as heart diseases, diabetes, cancers, and asthma are increasingly prevalent, which cause more than 3/4 of all deaths, and nearly 1 in 5 people die prematurely from NCDs. The government of Sri Lanka is committed in partnership with relevant UN entities to address many challenges still prevailing in these areas. Madam Chair, one of the key reasons for hunger, food insecurity, and malnutrition is the inability to afford the cost of healthy diets. Sri Lanka has a long and consistent history of implementing poverty eradication measures. The Samurdhi Welfare Program is one of the key initiatives that provide cash grants microcredit facilities, housing assistance, and support for education. And the Swadivimanga program is a proactive initiative aims to promote healthy lifestyles among our population. Madam Chair, we are of the firm view that a high-quality sustainable food chain would greatly contribute to the good health of the nations and help the world achieve critical progress on all the 17 SDGs. In this context, we are looking forward to the Food Systems Summit this year. We believe that this would generate the required international action relating to food systems progressing towards the 2030 agenda. In conclusion, Sri Lanka pledges its support for the ICPD program of action and to work with the international community to fully realize the aspirations based on the 2030 agenda. The full statement will be submitted to the Secretariat. I thank you, Madam Chair.
Doy las gracias.
I thank the distinguished representative of Sri Lanka. I would ask all delegations kindly to speak a little more slowly so that the interpreters can provide a better interpretation of your statements. I now give the floor to the distinguished representative of Suriname, to be followed by the distinguished representative of Belgium.
Thank you, Madam Chair. And I too congratulate you and the members of the Bureau on your election and extend our fullest support. Suriname, like many other countries, confirms the challenges to our population and development programs due to the impact of COVID-19 and the need to closely consider the impact that it will have on the implementation of the 2030 Agenda and the achievement of the Sustainable Development Goals and targets. We had made important advance with respect to the national population policy. This document is to supplement the recovery plan and the upcoming development plan for 2022 through 2027. However, in the last preparatory stages, we were confronted with the COVID-19 pandemic and have not been spared the negative consequences of it. Our country was already facing financial difficulties prior to the COVID-19 pandemic. Our sovereign debt is high, and the diminished value of our currency has resulted in an increase of prices of imported goods, including food. The situation has worsened by the negative impact of the COVID-19 pandemic, and the government is taking the necessary measures to overcome this financially adverse situation. Because of our vulnerable economy and limited national resources, however, we will not be able to address these challenges on a short term. Necessary measures have been taken to curb the number of COVID infections, and they have yielded overall good results. On the other hand, the negative impact of the pandemic on the socio-economic stability of many in the country is major. Due to the, at times, total lockdowns, a large number of men and women have lost their income. The education process has also been severely affected, and students are still in an uncertain period as to when their classes will fully resume. Entrepreneurs are faced with sharply declining income, and the tourist sector has come to a complete standstill. There are also signs of an increase in the number of domestic violence cases. With respect to the security of our food systems, the agricultural and export sector in particular is experiencing the negative consequences of COVID-19. The objectives of our agricultural policy are to guarantee food safety in accordance with international health and safety conditions, to increase the contribution to the economy and employment, to promote innovative production systems, and to reduce imported products by growing them ourselves. Now, however, the impact of the crisis threatens the food supply, both in terms of local production and imports. For both, we are dependent on products that need to be purchased abroad with foreign currency. But with a high sovereign debt and reduced income from the mining and agricultural sectors, we run the risk that in the not too distant future, we will not be able to meet the demand for food for our population and face undernutrition. Madam Chair, apart from the need to eliminate the visible material consequences of COVID-19, the psychosocial consequences also require proper attention. The financial situation in which we find ourselves complicates the establishment of a social safety net. In the face of all these challenges, as a result of the COVID-19 pandemic, we do not shy away, but try to meet these challenges with combined strength, trust, and hard work. Our goal is to continue to work steadily to diversify and strengthen our economy to ensure the health and prosperity of our people. Madam Chair, the government of Suriname expresses its sincere appreciation to our partners within the UN system who continue to support us in the fight against COVID-19 and in the ongoing implementation of the Program of Action of the International Conference on Population and Development. On our part, we reaffirm our commitment to the Program of Action and its further review and implementation. We emphasize that the full and effective implementation of these is essential to achieving the internationally agreed goals for sustainable development. Following the devastating impact of the COVID-19 pandemic, to end hunger, achieve food security, and improve nutrition, and to build a sustainable agriculture, urgent international action in solidarity and by cooperating at the different levels is needed now. Thank you much, Madam Chair.
I thank the distinguished representative of Suriname, and I now give the floor to the distinguished representative of Belgium, to be followed by the distinguished representative of Egypt.
Monsieur le Président.
Chair, Belgium was very satisfied to see the fruitful negotiations of a political declaration which reaffirms the relevance of the Cairo Programme of Action and which invites us to continue its implementation. Belgium wishes also to reaffirm its unwavering support to the comprehensive implementation of the Programme of Action from the CPD and its various reviews, as well as the Beijing Declaration and Platform of Action and the 2030 Agenda and its Decade of Action. The global health crisis that is affecting us at the moment reminds us clearly of the importance of solidarity and multilateralism to respond to the challenges before us. In terms of nutrition and food security, it is urgent that we adopt a holistic approach that brings together the conservation and sustainable management of water, promotion of sanitation, access to health and education services, as well as social protection and employment and the prevention of conflicts. A transition towards sustainable food systems is one of the current policy priorities for Belgium's development cooperation, much like agroecology and small-scale agriculture, to contribute thereto. Thus, Belgium is contributing to the general budget of the FAO, the WFP, and to the CGIAR. Access to healthy food is vital for all, and therefore we need to pay due attention to value chains, and particularly the quality of food, which must really be healthy and nutritious. A bad diet is the main cause of avoidable chronic diseases around the world. This means that we need to be more critical in how we look at the growing availability of processed food made available to us by the food industry. On a global level, the prevalence of moderate or serious food insecurity affects women more than men, while malnutrition is closely linked to poverty, inequality and social exclusion. Rural women, who bear primary responsibility still for subsistence farming, are rarely involved in investments, policies and programs. They continue to be broadly deprived of access to productive assets. For example, land and seeds, financial resources and access to services and agriculture. Strengthening food systems therefore must be inclusive and pay particular attention to women and young people. Chair, dear colleagues, investments in food security must also integrate the overall health of women, girls and adolescents. And it is vital if we want to talk seriously about sustainable development. If women are able to choose the time and spacing of childbearing, including the choice of having children or not, then this has a direct impact on access to food for families and communities, and also on access to education. This is a key factor enabling us to adapt to the impact of climate change. So health and sexual and reproductive rights and nutrition are thus a key tenet of the life of women, girls and adolescents because they have a direct impact on their development and on their future. Chair, dear colleagues, dear friends, gender equality, women's and girls' rights and the promotion of sexual and reproductive health and rights are long-standing priorities for my country, Belgium. On a national level, we are harvesting the fruit of lasting investment in this field. With 5 births per 1,000 women between 15 and 19 years of age, Belgium has one of the lowest teenage pregnancy rates in the world. With 8 abortions per 1,000 women between 15 and 48 years of age, Belgium is one of the countries with the lowest number of abortions around the world. These results are possible because we guaranteed access for girls and women to contraceptives, which are free in Belgium for women under 25 years of age, and we provide accessible information and advice through investing in comprehensive sex education. Belgium is proud also to contribute to the budget of multilateral organisations who are active in this field, such as UNFPA, UNICEF and UN Women. Belgium's international cooperation is very invested in sexual rights, sexual and reproductive health and rights, and also as part of governmental cooperation and through Belgian civil society organisations which are active in countries in the south. Finally, through our investment as a champion government within the She Decides movement, Belgium continues to fly the flag for women and girls to be able to decide what to do with their bodies, their life and their future. Because progress is urgent and necessary, Belgium will participate in the Generation Equality Forum organised by France and Mexico with the UN Women. And more specifically, we will make strong commitments within coalitions for action focused on tackling gender-based violence and to supporting sexual and reproductive health and rights. I thank you for your attention.
I thank the distinguished representative of Belgium. I now give the floor to the distinguished representative of Egypt, to be followed by the distinguished representative of Turkmenistan.
Thank you very much, Madam Chairperson. Allow me to congratulate the Chairperson of the committee and the Bureau for their tireless efforts. And allow me also to thank the Secretary General for his reports presented to our session, as well as recognize the efforts of the Population Division of the Department of Economic and Social Affairs and the UNFPA in the follow-up of the implementation of the ICPD Program of Action. Madam Chairperson, Egypt aligns itself with the statement delivered by the Republic of Congo on behalf of the African Group, and I would like to highlight the following points on national capacity. This session gains special importance as it takes place amid the COVID-19 pandemic that affected all aspects of life and resulted in major negative repercussions at all levels, which were greater felt by the developing countries. The selection of this session is theme, population, food security, nutrition, and sustainable development strengthens the linkage between the implementation of the ICPD Program of Action and the Sustainable Development Goals, especially Goal 2, end hunger, achieve food security, and improve nutrition and promote sustainable agriculture. According to the report of the Secretary General, in 2019, approximately 746 million people worldwide suffered from severe food insecurity and an additional 1.3 billion from moderate food insecurity. In Africa, more than 50% of the population was either moderately or severely food insecure. This situation was further exacerbated by the COVID-19 pandemic. The aforementioned challenges are further compounded by other factors, such as climate change, biodiversity loss, desertification, and moreover, water scarcity, especially in certain areas of Africa, such as the Sahel region, Eastern Africa, and the Nile Basin. Accordingly, the exceptional circumstances that we face today require immediate actions to confront these challenges through directing the political will of the international community towards deepening international cooperation at all levels to achieve our joint goals. It is in this context that Egypt hosted the ICPD 27 years ago, the conference that established direct link between population and achieving economic and sustainable development. Madam Chairperson, Egypt exerted continuous efforts in achieving food security and sustainable agriculture in a time that we are facing great hurdles connected to our water security, which is a prerequisite to achieve food security for over 105 million Egyptians. We are currently implementing a national program which aims at increasing agricultural productivity by 25% by year 2025, while also reclaiming 630,000 hectares of newly agricultural lands. Our endeavors are not only limited to the national level, but also extended to strengthen South-South cooperation, especially in Africa, through the Egyptian Agency for Partnership for Development. Moreover, we believe that the Food Systems Summit scheduled to take place in September 2021 in New York presents a perfect opportunity to regain the global momentum to reposition food security at the top of our global agenda. Madam Chairperson, to conclude, I wish to take this opportunity to reaffirm Egypt's commitment to the full and balanced implementation of the program of action of the ICPD in parallel to enhance achieving the Sustainable Development Goals, as well as in its complement to the success, as well as its commitment to the success of the 54th session of the Commission of Population and Development. I thank you very much, Madam Chairperson.
Doy las gracias.
I thank the distinguished representative of Egypt. I now give the floor to the distinguished representative of Turkmenistan, to be followed by the distinguished representative of Nigeria.
Excellencies, ladies and gentlemen, I was privileged to lead the delegation of Turkmenistan at the first international conference on population and development, which was held in Cairo, Egypt. The government of Turkmenistan was delighted to attend the Nairobi summit in November 2019 as part of the 25th anniversary of the International Conference on Population and Development, and announced a number of commitments at various levels: financial, policy, legislative, structural. These commitments intended to further advance the promises made in Cairo and advance progress towards the relations of the Sustainable Development Goals. The government has already made significant progress in fulfilling the commitments made during the summit, and this can be summarized as follows. In the area of gender equality and women's improvement, Turkmenistan has officially endorsed its National Action Plan of Gender Equality for 2021-2025, which includes a clear plan of action and monitoring framework, and is currently in its implementation phase. In order to harness its demographic dividend, the government is implementing a series of measures aimed at investing in young people's education, employment, opportunities, and health, including reproductive health, and has recently approved a new state program on youth with concrete action to be implemented over the coming year. In the area of universal access to reproductive health, Turkmenistan has taken the financial ownership of providing contraceptives for up to 80% of its most vulnerable population by 2025, and is integrating a total market approach in the country. Last but not least, in the area of data for evidence-based policy making, preparation for the 2022 housing and the population census and underway, while the first ever survey of domestic violence was completed and the report is being finalized. The Nairobi Summit on ICPD outlined the importance of rights and choice for all, energized the reproductive health and rights, and critical for achieving sustainable development, and the government of Turkmenistan continues to put necessary efforts to accelerate these promises to transform the lives of people, women and men, young people, including the most vulnerable population. Thank you for your attention.
Doy las gracias.
I thank the distinguished representative of Turkmenistan. I now give the floor to the distinguished representative of Nigeria, to be followed by the distinguished representative of Argentina.
Thank you, Mr. Chairman. Nigeria aligns itself with the statement delivered on behalf of the African Group. My delegation congratulates you and members of the Bureau on your appointments and pledges Nigeria's support and cooperation towards the successful conduct of this session. The impact of COVID-19 pandemic on global economies has undoubtedly disrupted the lives and livelihoods of most vulnerable and reduced the gross domestic product of particularly developing countries. For this reason, Nigeria appreciates the significance of the theme of this section: population, food security, nutrition, and sustainable development. Nigeria recognizes this nexus of population to food security and nourishment and nutrition, and its relevance to ensuring sustainable food and agricultural systems as fundamental elements.
Perdón por...
I apologize for interrupting our distinguished speaker, but due to the sound quality, the interpreters are not able to interpret your statement properly. I don't know if we should start over, if you're able to log in again.
Lo escucho bien.
I can hear you well. Please continue. Thank you.
Nigeria recognizes the nexus of population to food security and nutrition and its relevance to ensuring sustainable food and agricultural systems as fundamental elements for securing the well-being of our people now and in the future. Food insufficiency therefore negatively impacts on the development of people, community, and nation. Achieving sustainable economic development and harnessing the first and second demographic dividends in Africa remains an illusion without well-nourished and healthy people. Nigeria's population remains the largest in Africa and is seventh in the world. The prevailing global health and economic crisis have also brought about deepening food insufficiency and hunger to the vulnerable population in the country. In addition, the scale of violence and threats to life in parts of the country has left large numbers of displaced people, especially women and children, without access to food. The chronic malnutrition associated with micronutrient deficiencies raises concern on maternal and child health nutrition and poses a huge public concern. My delegation views this session as a veritable platform to identifying successes and best practices, as well as opportunities through constructive engagements and experience sharing on appropriate ways to address these unprecedented challenges. Therefore, the Federal Republic of Nigeria government put in place a systematic policy strategy to trigger an economic response to the enormity of the situation to reduce hunger and malnutrition, and consequently address the health threats posed to its population. Some of these strategies include implementation of an agricultural transformation agenda 2021 to 2015 to reintroduce sustainable agriculture hinged on business-like attitude driven by private sector. 2, national agricultural and food security strategy enabled in the ATF focused on increased food and nutrition security. 3, National Strategic Plan of Action for Nutrition 2014 to 2019. 4, National Policy on food and nutrition to address malnutrition and extreme hunger across different levels of society for an overall national development. 5, agricultural sector food security and nutrition strategy. 6, ongoing implementation of Africa's largest national school feeding program, which is a key part of Nigeria's human capital development agenda that aims to tackle the broader issue of poverty eradication, food and nutrition security, and reduction in the number of out-of-school children. And also, lastly, economic recovery and growth plan with attention on agricultural transformation and food security. I also wish to underscore that Nigeria is committed to ensuring greater agricultural yield through the provision of various capacity building schemes for small holder farmers to ensure that they are adequately equipped to respond to the rapid population growth and enable sustainable food production. Another area is the government's implementation of targeted, effective nutrition policies for children and pregnant lactating women, with a view to ensuring community and household resilience at coping with unexpected shocks, as well as prioritization of empowerment program for women and the rural poor. Madam Chair, in conclusion, Nigeria calls on the global community to adopt appropriate strategy for the prevention and management of maternal and child undernutrition in Africa, particularly for those in conflict situations and humanitarian spaces as a priority. Nigeria will continue to collaborate with relevant stakeholders and United Nations systems to address concerns for food insecurity and nutrition. Merci beaucoup.
I thank the distinguished representative of Nigeria. I now give the floor to the distinguished representative of Argentina, to be followed by the distinguished representative of Haiti. Thank you very much, Madam Chairman. I'd like to begin by thanking and highlighting the work and the leadership of Ambassador Eric Tiare and the members of the Bureau for their efforts to ensure a successful 54th session of the Commission. I would like now to refer to my country. Argentina is working towards a model of development which combines economic growth with social inclusion. Our country, therefore, is very committed to gender equality and equity, and therefore we have drafted normative frameworks and public policies for health and sexual and reproductive rights of women and girls. I would highlight the following. In 2019, we established the Ministry for Women, Gender and Diversity. And since July of 2020, we have implemented a national action plan against gender-based violence so that we can build a fairer society without violence against women or LGBTI people. We have a law on voluntary termination of pregnancies, which recognizes the right to interrupt or to terminate a pregnancy. And pregnant women are no longer criminalized for terminating a pregnancy in the first 3 months. We have a comprehensive health care law for women who are pregnant and for children in early childhood. The comprehensive health care system provides an allowance which involves paying a yearly allowance per child for care of that girl or boy under the age of 3. We also have a marriage equality legislation to promote and enforce equality, non-discrimination, and recognize restitution of rights, fully respecting diversity. Internationally, Argentina is party to all of the primary international instruments in this area, and I would highlight our participation in 2020. We co-chaired, along with Burkina Faso, Denmark, and France, the Action Coalition on Bodily Autonomy and sexual and reproductive health rights within the UN Women's Generation Equality movement. We must not lose sight of the fact that hunger and malnutrition continue to be some of the main challenges we are facing, and that is even more true during the pandemic. Projections by various regional and international organizations have warned us that we are facing considerable setbacks in combating food insecurity and malnutrition. This will have a negative impact on the implementation of Agenda 2030 for Sustainable Development. In order to address this situation of food insecurity, Argentina established the Argentina Plan Against Hunger. This is a state policy based on a comprehensive, consensus-based, and participatory approach involving various actors of society so that we can reach the most vulnerable people. The main tool that we have is a food card. This provides a monthly credit for card holders to supplement the family income so that they can afford food. Similarly, Argentina also recognizes the importance of family farming as a means of agroecology, and we have promoted the Pro Garden program and planting food sovereignty, which includes access to resources, models of agroecological food production, and the right to eat healthy food, just to mention but a few. Our national agro-food industry has adapted rapidly to our new reality. We have been complying with strict health protocols, and we've been reinforcing logistical networks. And given our extensive experience in Argentina in the area of food export and production, we are committed to promoting and strengthening sustainable food systems in 3 key areas: economic, social, and environmental. The pandemic has reaffirmed the need to strengthen the sustainability of our agro-food systems and to have a multilateral trade system based on rules which are open, non-discriminatory, and fair, with the WTO at the center of those efforts in order to maintain predictability and transparency in trade flows and allow for the development of productive zones that show great potential so that we can provide safe, quality food. We must address long-standing, pending issues, in particular reforms in agricultural trade rules and bans on fishing subsidies. Given the importance of working together, both regionally and globally, so that we can find a common response to global challenges, Argentina is participating actively in the preparatory process leading up to the UN Food System Summit to be convened by the Secretary General in 2021. We reaffirm Argentina's commitment to a strong multilateral system. In the midst of these difficult pandemic circumstances, in this commission, my country would like to highlight the importance of having a consensus document, a balanced text, which reflects the concerns and interests of all UN members on issues which are relevant to all of us. In these difficult times, Argentina has prioritized saving lives and caring for the most vulnerable by implementing recovery measures which will help us avoid a collapse of the healthcare system and mitigate the immediate fallout of the pandemic. We are focusing primarily on the most vulnerable sectors. Thank you very much. I thank the distinguished representative of Argentina. I now give the floor to the distinguished representative of Haiti, to be followed by the distinguished representative of Japan.
distinguido representante.
Distinguished representative of Haiti.
Volveremos a
We will call on the distinguished representative of Haiti again, so let me now give the floor to the distinguished representative of Japan.
Thank you, Madam Chair. First of all, let me work as board members of this important commission. Japan is concerned about the vast and protracted impacts of the COVID-19 pandemic that we are witnessing all across the world. We would like to take this moment to express our utmost respect to all those who are working tirelessly to tackle COVID-19 in every country. The COVID-19 pandemic has also had devastating indirect impacts on social and economic circumstances and demographic trends as a result of response measures such as lockdowns and restrictions on the movement of people and goods. In the context of population, food security, nutrition, and sustainable development, there is a great concern that the world is not on track to achieve the goal of eliminating hunger by 2030. Under the current difficult circumstances, where the most vulnerable people will face further greater hardship, global efforts to respond swiftly to this human security crisis are required. As a staunch supporter of the concept of human security, which aims to ensure that everyone enjoys life with dignity with no one left behind, Japan, working in cooperation with FAO and WFP, has been supporting the restoration and strengthening food security, food supply, and nutrition, including through emergency food assistance. For example, at the 6th meeting of Tokyo International Conference on African Development, TICAD 6, held in 2016, Japan established the Initiative for Food and Nutrition Security in Africa, in cooperation with a new Partnership for Africa's Development, NEPAD, in order to provide support to 10 pilot countries in Africa to promote policy formulation and implementation for improving nutrition. The initiative has since been expanded to cover several additional countries throughout the African region. Japan will also be hosting Tokyo Nutrition for Growth Summit 2021 in December this year. The COVID-19 pandemic reminds us of the critical importance of nutrition in the context of the prevention and treatment of infectious diseases. As host country of the Tokyo Nutrition for Growth Summit, Japan supports the United Nations Food Systems Summit to address global nutritional disparities and malnutrition, and will play an active role in accelerating international efforts to resolve the issues of hunger and malnutrition. Furthermore, while we see a direct impact of food security and nutrition on individual health, human health throughout the life cycle, food security and nutrition also have connection to larger demographic trends, including fertility, mortality, urbanization, and migration. Therefore, we welcome further discussions from a global perspective to promote food security and to integrate nutrition component into the concept of universal health coverage. Finally, we look forward to working closely with the Commission on Population and Development and expect this conference to be a solid driver leading to both the Food Systems Summit and Tokyo Nutrition for Growth Summit 2021. I thank you, Madam Chair.
I thank the distinguished representative of Japan. I now give the floor to the distinguished representative of Haiti, to be followed by the distinguished representative of Malawi.
Madame la Présidente,
Madam Chair, I'm making this statement on behalf of the Minister of Foreign Affairs of Haiti, His Excellency Dr. Claude Joseph, who, for reasons out of his control, was not able to participate as planned in the 54th session of the Commission on Population Development. Chair, ladies and gentlemen, first of all, I wish to extend the greetings of the President of Haiti, His Excellency Mr. Jovenel Moïse, as well as a message of friendship from the Haitian people to all participating countries. The 54th session of the Commission on Population and Development is of vital importance for the government of the Republic of Haiti. Not only because it is being held in a context marked by the COVID-19 pandemic, but also and above all because it coincides with the first year of stock-taking of actions and activities undertaken by the UNFPA for the 2020-2030 period. It is telling that the theme Population, Food Security, Nutrition and Sustainable Development chosen for this 54th session is the same as the one that was established for the 53rd session, which could not take place in 2020 because of the health crisis caused by coronavirus. I wish to underscore the pressing need for each and every one of us to work to strengthen international solidarity, alongside actions undertaken by the poorest countries to face the chronic problem of food insecurity, particularly in Haiti. Here, I reiterate and renew the support and tireless commitment of the Republic of Haiti to the effective implementation of the Cairo Plan of Action that many countries lauded during the summit marking the 25th anniversary of the International Conference on the Population Development, which was held in Nairobi in Kenya. Chair, it is important to underscore that as we look at the issue of food security, a certain number of factors at play in Haiti's favour, such as its geographical proximity and its priority access to important markets, such as the United States of America. It also has quite a young population, and it has a substantial and supportive diaspora. However, despite its rich agricultural potential, Haiti today imports almost half of the goods consumed by its people. If we look at rice, which is more and more becoming the main product of consumption in our country, 83%, around 83% is imported. The weakness or the low productivity in the agricultural sector and the knock-on effect, meaning that it is non-competitive, these are just a few of the factors that mean that our country is so dependent on imports, on food imports. In addition to this, we've had various repeated social political upheavals, and then there's the global health crisis linked to coronavirus and a lack of investment in the sector. As we do commend the remarkable work done by the World Food Programme on the ground, nevertheless, the Haitian government wishes strongly to have a greater mobilisation and level of solidarity, international solidarity, so that we can face the acute problem of food insecurity. Chair, distinguished delegates, I believe it important to underscore also, as we seek to scrupulously follow the international commitments that Haiti has made, the government has established and adopted, which was in March 2021, a national policy and strategy for food security and sovereignty. This public policy document was fruit of long and far-reaching consultative process, which was supported by the FAO and other bodies within the UN system. It specifies Haiti's commitment to achieving the SDGs, particularly SDG 2 on zero hunger. And it's through supporting family, agriculture and agro-industry. With this in mind, President Jovenel Moïse's administration is continuing to step up and promote and develop various branches of agricultural production. The measures that have been adopted seek to reduce the country's dependence on outside. It seeks to create wealth and also strengthen food security. Along the same lines, the Haitian government officially adopted in January 2020 our post-COVID recovery plan for the period of 2020-2023. This plan aims to support the country in addressing the consequences of the health crisis and address the development challenges in the mid and long term in Haiti so that we can breathe new life into our economic growth and put our country firmly on the path towards sustainable social and economic development. I thank you very much.
Doy las gracias.
I thank the distinguished representative of Haiti. I now give the floor to the distinguished representative of Malawi, to be followed by the distinguished representative of the Holy See.
Thank you, Madam Chair. First and foremost, let me join the previous speakers in congratulating you for assuming the chairmanship of this 54th session of the UN Commission on Population and Development and all members of the Bureau. I wish to assure you of my delegation's cooperation and constructive engagement for the successful conclusion of this session. I also wish to thank the Secretary General for his comprehensive report, which will inform and guide our deliberations. Malawi aligns itself with the statement made by the Republic of Congo on behalf of the African Group. Chairperson, this year's theme provides an opportunity to highlight the interlinkages between population, food security, nutrition, and sustainable development, since a growing population exerts pressure on natural resources and compromises food security. This is true for Malawi, which has one of the world's highest population growth rates at 3% per year. Its current population size of almost 19 million is expected to double by the year 2060. Malawi relies on agriculture to sustain its people and support its economy, accounting for almost 30% of GDP and 64% of the country's labor force. Continued increase in population is estimated to reduce our arable land per capita by 57% by 2050. Thus, the impact of high population growth rate on food security and nutrition cannot be overemphasized. The government of Malawi attaches great importance to this year's theme, particularly as the COVID-19 pandemic continues to reverse decades of hard-earned socioeconomic progress across the globe. The pandemic has disrupted public health service delivery, food systems, increased poverty, and undermined major nutrition provisions, such as school feeding programs. It has heavily impacted women and girls, resulting in an increase of school dropouts, teenage pregnancies, and gender-based violence. Food security, nutrition, and adequate public health service delivery are integral to healthy pregnancy, maternal health, and sexual reproductive health that are crucial for the achievement of gender equality and women's empowerment. Ensuring continuity of maternal and neonatal care and continued provision of sexual and reproductive health rights, services, and information, including those related to family planning, remains a priority. With the support of the various partners, including the UN Population Fund, the government of Malawi continues to strive towards achieving universal access to sexual and reproductive health and reproductive rights of women and young people. For instance, in 2020, we provided services to over 385,000 young people, procured and deployed 6 mobile vans for promotion of access to youth-friendly health services in hard-to-reach areas, and developed the first ever comprehensive sexuality education digital application for school-going children. All these interventions are in line with the Malawi Growth and Development Strategy 3 and the Malawi Agenda 2063, which recognizes population and health as one of the 5 key priority areas for sustainable and inclusive development. Chairperson, in conclusion, let me point out that Malawi remains committed to the goals and objectives set out in the International Conference on Population and Development Program of Action and other outcomes of the major United Nations conferences and summits. The full text of our statement has been submitted to the Secretariat. I thank you for your attention. Thank you.
I thank the distinguished representative of Malawi. I now give the floor to the distinguished representative of the Holy See, to be followed by the distinguished representative of the League of Arab States.
Madam Chair, the Holy See is pleased to participate in this 54th session of the Commission on Population and Development and to offer some reflections on its special theme, population, food security, nutrition, and sustainable development. Despite the efforts undertaken in the last decades, the number of people experiencing hunger, food insecurity, and malnutrition is growing. In many regions of the world, millions of people, including children, do not have access to the most basic resources and lack safe, nutritious, and sufficient food. The COVID-19 pandemic has further worsened this grave and widespread situation and has exacerbated the vulnerability of those already living in precarious situations. Furthermore, solutions to food insecurity and malnutrition have proven to be far more complex than food production alone. While 820 million of the world's people suffer from hunger, almost 700 million are overweight, victims of improper dietary habits. To ensure, therefore, that every person has access to his or her daily bread, it is essential, instead, to guarantee that distribution of food is equitable and that healthy diets are accessible and affordable to all. Concrete measures to end hunger must always respect human dignity and the recognition of the right of every person to be free from poverty, hunger, and malnutrition. This entails the duty of the entire human family to provide practical assistance to those most in need. In this regard, the Catholic Church, throughout her many organizations, initiatives, and charities present on the ground throughout the world, is at the forefront of efforts to ensure that no one goes hungry. In many cases, the meals that they distribute are the only source of quality and nutritious food, especially for the rural and urban poor, migrants, refugees, homeless, and the elderly, who as a result of the COVID-19 pandemic have been affected by even greater exclusion, isolation, and loneliness. Madam Chair, population growth is often cited as a major cause of the increasing numbers of people experiencing food insecurity, leading to the conclusion that fertility rate reduction strategies are the answer. The past decades, however, have shown this is to be incorrect. Population growth has rather gone hand in hand with significant increases in food production, demonstrating that it is fully compatible with shared prosperity and the achievement of integral human development for every person. Consequently, the real challenge before us is not the world's growing population, which is a great resource, but rather inequality, poverty, and lack of development. The remedy should be sought in authentic, integral, and sustainable development efforts, and in particular, in policies and programs that stimulate employment, ensure investments in basic public services for all, foster good stewardship of resources, including natural resources, and assist the family, the fundamental unit of society, by providing it with adequate and efficient means of support, both for bringing up children and looking after the elderly, those in vulnerable situations and those with disabilities. The violation of the inherent and inalienable right of every person to life is not and must never be the answer to the many challenges arising from sustainable development, population growth, and the rising level of food insecurity and malnutrition. Rather, respect for life from the moment of conception to natural death must be at the core of development policies. Moreover, international solidarity and aid should be encouraged and genuinely focused on the priorities and needs of the receiving nations. Thank you, Madam Chair.
I thank the distinguished representative of the Holy See. I now give the floor to the distinguished representative of the League of Arab States, to be followed by the distinguished representative of the International Federation for Family Development.
Your Excellency, Your Excellency, Chairman of the 54th session of the Commission on Population and Development, ladies and gentlemen, we meet today as the Arab region faces health, economic, and geopolitical circumstances which directly affect its population. The pandemic and its resulting global health crisis have unveiled the great need for good population planning in public health and hospitalizations policies, especially as governments were faced with gaps in overcoming the pandemic and as their health systems came under tremendous pressure. The pandemic's dangers are not limited to a country's health system and policy measures. They are also related to demographic factors such as age, geographical distribution, and social behavior. As the world witnessed a complicated global health scene, the Arab Council for Population and Development was established in October 2019 in Amman, Jordan, 2 months before the pandemic, as a mechanism for joint Arab work and a part of the Economic and Social Council at the League of Arab States. Its establishment is a key regional achievement in terms of population and development. It provides an institutional framework for joint Arab work to support and promote issues of population and development, and to provide technical support to member states in keeping up with regional and international developments. Following the pandemic, the Council amended its program and activity agenda to address this urgent global requirement and help member states in alleviating the impact of the pandemic. For this year, the Council has a busy agenda to promote capacities of national population councils and committees in line with the latest COVID developments. This will provide national councils with the technical expertise to support Arab governments in developing population programs and plans to achieve sustainable development. Ladies and gentlemen, Arab states have given special attention to food security, especially at the 2009 Kuwait Summit, where the Urgent Food Security Project was launched. This project includes 3 phases to be implemented between 2010 and 2030 and was adopted with the participation of governments and the private sector based on their relevant commitments. To achieve Arab food security, the Arab Strategy for Agricultural Development was developed to prepare and implement joint plans and programs to monitor agricultural natural resources, ensure land reclamation, and end desertification. In conclusion, we have to think together and reshuffle our priorities. We need to amend our policies and programs and adapt them to the current and any potential crisis. Our national development plans need to focus on population issues. Thank you.
I thank the distinguished representative of the League of Arab States. I now give the floor to the distinguished representative from the International Federation for Family Development, and to be followed by the distinguished representative from the Irene Menakaya School, Onitsha.
Thank you, Madam Chair. The COVID-19 pandemic and the associated disruption of many education, health, social, and family services have emphasized the importance of family support services, including healthcare and mental health services. Child protection supports towards basic material needs such as food and housing, and specialized services for vulnerable families. Since the whole range of needs has to be addressed simultaneously when targeting families, the challenge for policymakers is to develop a package to tackle the needs of different families and deliver it in an integrated manner across different public agencies and a range of service providers. The International Federation for Family Development is proud to have contributed in a recent OECD report on family support services meant to help policymakers, family professionals, and researchers. The report analyzes some key aspects for the theme of this commission. It features that the supply and quality of family support services vary across often within countries, but sharing evidence on good service delivery practices and efficient service organization is crucial to ensure that the service provides benefit to families who need the most. In this regard, following up on the Secretary General's report for this commission, we're committed to support family-responsive legislation to transform the food supply and demand, as well as institutional reforms. Families around the globe must be well-nourished and healthy to achieve the goals and objectives of the ICPD and the 2030 Agenda for Sustainable Development. Finally, we celebrate the civil society engagement that the Commission's Bureau has shown this year. We have been able to actively advise on the future role and organization of the Commission. Also, we felt heard on substantial changes regarding the side events organization process. We look forward to more ways to enrich the Commission's work. Thank you, Madam Chair.
I thank the distinguished representative of the International Federation for Family Development. I now give the floor to the distinguished representative of the Irene Menakaya School, Onitsha, to be followed by the distinguished representative from the International Catholic Committee of Nurses and Medico-Social Assistants.
Thank you, Madam Chair. This statement is being presented on behalf of Irene Menakaya School and African Cultural Promotions, Inc. Madam Chair, we congratulate you and your committee and wish to inform that in our years of community outreach on quality and inclusive education, we are encountered with issues about balancing the human existence through sustainable nutrition and well-being. We are all aware that the strength of sustainable living and good life rests on good food and balanced nutrition. However, in rural communities, this seems to be far-fetched. Knowledge and practice of balanced nutrition and good food are denied due to poverty, high rate of hunger, lack of proper nutrition education, and the practice of well-being. People with various health issues such as internal and endocrine health are left at the border of life and death because adequate measures are not taken on proper health diet, availability of right food from the community food system on affordable cost, and lack of proper education. Madam Chair, the effect of this reflects in the increase on death toll in communities, showcasing negative effect on population growth on the part of middle and adult age. This can be prevented by excellent management of health through adequate nutrition and education. Madam Chair, the Irene Menakaya School and African Cultural Promotion, Inc. strongly maintain that right education should be taken to communities on quality and inclusive education on health, nutrition, and well-being. Population attention should be geared towards control of high death rate, especially among the working and the reproductive age. Community dwellers' effort on rural agricultural production should be given adequate support by government and international agencies to help balance the high growth of hunger in today's food system and in affordable terms. Concerted efforts to be provided to include policy measures that could enable dietary knowledge and understanding in the minds of rural dwellers, thereby encouraging them to adopt balanced diet formula based on affordable and available food from their environment. Madam Chair, with the present global adjustment to COVID-19 pandemic and knowledge of possible worse pandemics coming, adequate consideration on population based on nutrition and food security in communities should be the most needed concern as is stressing body immunity in keeping to the lives and well-being of humanity. I thank you.
I thank the distinguished representative from the Irene Menakaya School. I now give the floor to the distinguished representative from the International Catholic Committee of Nurses and Medical Social Assistants, to be followed by the distinguished representative from the Family Center for Human Rights.
Commission, thank you. Commission Chair, distinguished panel members, national representative, and guest. During the First World Food Congress in 1974, Henry Kissinger made a famous statement saying that within 10 years, no child would go to bed hungry. Nearly 40 years later, a UN report by then confirmed that there is enough food produced to feed everyone of the 7.5 billion people in the world today. Despite the presence of a sufficient food supply, according to MT Cullen, over 2 billion people do not have regular access to safe, nutrition, and sufficient food. The World Bank report in 2021 states that global food insecurity is not due to the lack of supply, but rather economic pressures, pandemics, natural disasters, conflict, and malnutrition continues. According to the World Food Program in 2019, 1 in 9 persons experience hunger, while 45% of deaths in children ages 5 are caused by poor nutrition. At least 1 in 9 persons experience hunger, as I mentioned. Statistically, higher rates of non-communicable diseases such as cardiac disease, diabetes are found among the poorly nourished. In addition, malnourished weakens our immune system, the capacity of the body to fight infections, including COVID. Infections affect our immune system. With weak immune systems, individuals' resistance to infection is diminished. As nurses, we administer care to individuals who are, and families, communities who are in favorable conditions, as well as those in economic crisis such as pandemics, disasters, and conflicts. CCM nurse members consider global commitment to food access, food safety, food quality, and societal imperative. According to the World Health Organization, essential dietary components of nutrition foods such as protein, carbohydrates, fats, vitamins and minerals, and waters are essential and need to be provided in balanced food so the body can grow and make the immune system more healthy. Alex DeWall in 2018 stated that famine strikes selectively. It's the poor and the politically excluded who are first and the principal victims of commonly the ones who mainly are affected. To put an end to starvation and hunger myths, for example, the starvation is related to rapid population growth must be understood as false. Famine related to deaths are decreasing. Solutions to hunger, malnutrition, and starvation have diverse causes requiring innovative political remedies that are supported. A worldwide approach can ameliorate hunger and malnutrition. Recommended strategies from our organization include community-based management of hunger and malnutrition, food waste reduction programs, sustainable farming, development of food banks, use of digital technology for planning, use of drones for delivering supplies, and ongoing education and community. In closing, consider the words of Pope Francis and Saint Mother Teresa of Calcutta. Pope Francis states, "It is a scandal that there is still hunger and malnutrition in the world. It's not a question of immediate emergencies, but of dressing together all levels of problem and challenges of personal and social conscience in order to achieve just and lasting solutions. May no one be obliged to abandon his country and his own cultural environment due to lack of essential means of substance." And Mother Teresa of Calcutta states, if you can feed hundreds of people, that if you can't feed hundreds of people, then try to feed one at a time. Thank you on behalf of the International Catholic Committee of Nurses Medical Social Assistants from Africa, Asia, Europe, and Pan American regions.
I thank the distinguished representative from the International Catholic Committee of Nurses and Medico-Social Assistants. I now give the floor to the distinguished representative of the Center for Family and Human Rights, CFAM, to be followed by the distinguished representative from the Society for the Psychological Study of Social Issues.
Thank you, Madam Chair. Access to food and good nutrition is one of the most basic needs of every human being. As population has increased, so too has agricultural innovation to ensure that a sufficient food supply can be generated. However, distributing that food presents challenges, and these have been exacerbated by the pandemic of the last year. This is a pressing topic and worthy of the attention of the Commission on Population and Development. Nevertheless, it is troubling that several times in recent years the Commission has failed to reach consensus, and the same controversial issues that strained the process to the breaking point are reemerging yet again and threatening to prevent an agreed outcome on a topic on which there is much room for agreement. The concept of sexual and reproductive health and rights, or SRHR, has never been adopted nor defined by the General Assembly, and to the extent that it has been defined, it includes elements that have also been repeatedly rejected by the General Assembly, such as a right to abortion. Madam Chair, to the extent that SRHR contains uncontroversial elements, there are already widespread agreements. Reducing maternal mortality has been a high priority from the International Conference on Population and Development to the Millennium Development Goals to the Sustainable Development Goals, and progress is being made to ensure safe childbirth around the world, albeit more slowly than we would wish. To that end, nutrition is a key component, as maternal anemia is a critical risk factor for maternal deaths. For children in the first 1,000 days of life, which begins in the womb, good maternal nutrition supports healthy pregnancy and subsequent breastfeeding to ensure that every child has a healthy start to life. We hear much about unmet needs for family planning, yet the main reasons for such needs are not lack of access, but concern about side effects, personal opposition, or low perceived risk of pregnancy. But when an unmet need for food exists, it is far more likely to be a matter of access and cost, and not the result of a personal choice. So we urge the Commission to maintain its focus on this year's theme, especially during this difficult time in global history, and to resist seeing another opportunity for consensus lost due to needless controversy. I thank you.
Doy las gracias a la
I thank the distinguished representative from the Center for Family and Human Rights, and I now give the floor to the distinguished representative from the Society for Psychological Study of Social Issues, to be followed by the distinguished representative from the World Youth Alliance. I'd like to remind all speakers kindly to speak a little more slowly so that the interpreters can properly interpret your statements. Thank you.
Thank you, Madam Chairwoman, and the Society for the Psychological Study of Social Issues and co-sponsors thank the Commission on Population and Development for this opportunity to highlight the effects of water stress on children's psychological and cognitive development. Access to safe water is fundamental to human rights. Psychological and medical evidence establishes that water stress caused by pollution, forced migration, and agricultural production contribute directly and indirectly to poor physical and mental health, beginning in childhood. The UN General Assembly recognizes the human right to water and sanitation as essential to the realization of all human rights, that water is a connector touching all aspects of society, and that water is required to achieve progress on the United Nations' 17 interrelated Sustainable Development Goals, including poverty reduction, SDG 1, and promotion of health and well-being, SDG 3. Children are harmed developmentally when experiencing water stress. Their immature metabolic pathways limit their ability to excrete toxic pollutants. Nearly 1,000 children die daily from water-related diarrheal diseases and are 12 times more likely to die of lung cancer and other respiratory ailments due to prenatal and early childhood exposure to arsenic in drinking water. Evidence from Bangladesh, China, and the US suggests that arsenic, lead, and other toxic chemicals depress children's growth and cognitive functioning, leading to long-term impacts on cognitive abilities and risks of developing mental illnesses such as bipolar and post-traumatic stress disorder as adults. Water stress caused by pollution, droughts, floods, or man-made crises may force families to migrate, increasing susceptibility to illnesses and diseases. In this age of COVID-19, rates of illnesses and death in refugee camps will rise, in part due to inadequate access to clean water and sanitation. UNHCR estimates that children under the age of 18 comprise 52% of all displaced persons. With particular reference to the CPD draft resolution, paragraph OP11, Society for the Psychological Study of Social Issue advises, quote, that children who are given the opportunity to grow and develop in a health environment free of toxins and pollutants, that is responsive to their needs, including breastfeeding, and that at a young age fosters and encourages healthy behavior and lifestyles, including healthy dietary choices and regular physical activity, and promotes the maintenance of healthy weight, can greatly reduce the risk of non-communicable diseases and mental and cognitive defects that begin in childhood and continue into adulthood. I thank you, Madam Chairwoman.
Doy las gracias.
I thank the distinguished representative from the Society for the Psychological Study of Social Issues. Once again, I would ask the participants to speak slowly in order to facilitate interpretation. I would also like to remind delegates to stick strictly to the time limits so that we can hear all of the speakers in this debate. I now give the floor to the distinguished representative from the World Youth Alliance, to be followed by the distinguished representative from FEM Foundation.
Good afternoon, Madam Chair, distinguished delegates, ladies and gentlemen. We are grateful for this opportunity, and I am proud to represent the World Youth Alliance, a coalition of young people throughout the world who are dedicated to promoting and protecting the dignity of all human beings through policy, culture, and education. We recognize that dignity is the basis for all human rights, and we affirm that human beings are at the center of all concerns about sustainable development. All human beings have the potential to be creative and productive problem solvers. At the heart of developing this potential is equal educational opportunities and accountable institutions that form and shape us in solidarity with others. First among these institutions is the family, which the Commission should recognize and affirm as the fundamental social unit, where people are able to fulfill their social obligations. Families are able to provide food, shelter, and education to each other, even in the most difficult circumstances. Therefore, we call on member states to pursue policies that promote the healthy growth of the family. When it comes to mitigating the negative impacts that the COVID-19 pandemic has brought upon the world, especially in developing countries, it is the family that needs strengthening in order to provide opportunities for education and the authentic development of each child. Education and maternal health services allow women to make the choices that are best for their family and take full control of their fertility with the knowledge required to make such decisions. Family planning programs must respect local needs and customs while empowering women and families to achieve healthy outcomes. This is why we are excited to promote FEM and other knowledge-based approaches to women's reproductive health. FEM engages women in the understanding of their bodies and then links them to medical support to diagnose and treat root causes. This respects the dignity of women and families while empowering them to be agents in the choice and use of their own healthcare. In addition to providing these needed programs that respond to the real unmet need of women and families, WIA firmly and fully rejects abortion as an element of reproductive health. Abortion ends one life and harms another, and can never be part of a healthcare system that supports human dignity. Focusing solely on contraceptive use does not address the needs of women who want to control their fertility without using contraceptives, and controversial policies, such as abortion, should never be promoted as part of reproductive health. To meet the needs of all women, we call on member states to include fertility awareness methods of family planning, which is rooted in scientific knowledge about female fertility and has been proven to be effective. When the family thrives and people are able to flourish, then sustainable development can be achieved. Human beings are the Earth's greatest resource, and increasing access to human capital will hasten the pace at which sustainable development is achieved. To that end, we call on the Commission to promote policies that promote the human dignity of every person, because people are at the center of sustainable development. Thank you.
I thank the distinguished representative from the World Youth Alliance. I now give the floor to the distinguished representative from FEM Foundation, to be followed by the distinguished representative from the ACT Alliance, Action by Churches Together.
Madam Chair, distinguished delegates, ladies and gentlemen, it is my honor to represent the FEM Foundation at the 54th Conference on Population and Development. FEM is a knowledge-based health program for women, inspired by women's right to be informed participants in their own healthcare. FEM's work includes health education for women, medical training, and reproductive health research, which undergirds all of our work. International law recognizes a right to the highest attainable health, reflected in the Sustainable Development Goal number 3. Health can affect the ability to ensure adequate nutrition through the ability to care for oneself, seek gainful employment, or process nutritious foods well. Certain health conditions, including some linked to hormones, also require particular nutrition programs. FEM offers care to women that addresses these health needs complementary to nutrition and promotes hormonal health is linked to overall health, and therefore sexual is attainable standard of health care.
Al parecer,
It would seem that the distinguished representative from the FEM Foundation is dealing with some technical problems. Let's continue with the list of speakers. I will now give the floor to the ACT Alliance, Action by Churches Together, to be followed by the distinguished representative from the International Planned Parenthood Federation.
Thank you very much. Action by Churches Together, ACT Alliance, is a coalition of more than 150 churches and church-related organizations working together in over 120 countries to create positive and sustainable change in their lives of poor and marginalized people, regardless of their religion, politics, gender, race, or nationality. We stand up for the integrity of the United Nations and the importance of multilateralism and embrace cooperation as the means to resolve global injustices. As a faith-motivated, as rights-based alliance, we believe that all people are rights holders and our action as a faith-based constituency adheres to the principle that universal and indivisible human rights are the cornerstone of international human rights legislation as emphasized in the Universal Declaration of Human Rights in 1948. We are committed to the ICPD program of action. We call upon member states to move this agenda forward and commit to non-regression on previously agreed language in the context of food security, nutrition, and sustainable development to ensure access to sexual and reproductive health and rights and protection from sexual and gender-based violence. The COVID-19 pandemic and the related aftershocks are pushing women and girls in all their diversity further into poverty. To address the COVID-19 pandemic and achieve the Sustainable Development Goals, we call upon member states to develop and implement ambitious gender-sensitive national plans which address the interconnections and interdependence between sexual and reproductive health, human rights, and sustainable development goals. We advocate for the integration of nutrition into family planning programs to achieve healthier pregnancies and birth outcomes. Gender discrimination is a critical element in access to adequate nutrition and food. In many places, women and girls are the last to eat and are denied certain nutritious foods due to taboos while pregnant or breastfeeding. Finally, it is crucial to promote and strengthen strategies to engage faith leaders, actors, and communities in the ICPD program of action. Faith-based actors often provide critical services during times of crisis at a community level, including food insecurity, and have access to where governments have difficulty in ensuring an institutional presence. Members of ACT Alliance are working as faith actors to transform societal norms, harmful attitudes relate to gender roles, and work on critical theological understandings that deconstruct gender stereotypes, promote women's rights, bodily integrity and agency, and contribute to equality and justice for all genders. Thank you.
Muchísimas gracias.
Thank you very much to the representative from the ACT Alliance, Action by Churches Together. Because of time constraints, we have now heard the last statement delivered for this afternoon's meeting. The general discussion will continue tomorrow at 11 a.m., immediately following an expert panel on the program of work in population, which will begin at 10 a.m. on this platform. The meeting is adjourned.